Morning, Chrissy.
Hi, Janine. How are you?
I'm good. Welcome to our very first episode.
I know, very exciting.
Yes. Now, we are very brand new to podcasting and, we've just had a conversation because this is I think our fourth attempt of learning the technology. Dear. But we're excited to finally launch our very first episode. And the first one we've titled Botox Debunked. We want to talk about Botox. We're calling it Botox, but we actually really mean anti-wrinkle injections because there's six on the market, but people will know it by Botox. So we're just going to call it Botox just to
Yeah,
make it simple. But we're going to debunk some myths and misconceptions about this treatment today. So we're going to start with a little bit of history because it's actually really interesting how they discovered this toxin, basically. It's found everywhere in nature, but there was an incident in the early 1800s where there's these people in Germany that got what they call botulism, which is this temporary paralysis. And it killed a lot of people and made a lot of people sick. And it was they found out that it was because they ate this raw blood sausage. Now, that's pretty disgusting. But anyway, they ate
I
this raw
think that
blood
sounds
sausage.
foul.
It was called the sausage poison hypothesis. And there was a guy called Justinus Kerner who thought, you know what, I actually think there's something in this. And they started doing, over years and years and years and years, they started doing experiments. And in 1989, it was actually FDA approved for medical use for involuntary spasms and things like that. And it's still used for those indications today. It's actually a
Mm.
very widely used product. And then obviously from there, it's progressed into the um, anti-aging scene. And you know what? I don't think anti-aging was a thing back then, but it's just emerged over the last
I
decades,
don't
which
think
is,
anyone aged back in those days because
I
they
know they
didn't
had
live
good diet.
past, a certain age anyway, you know?
So, we have six products in Australia that are TGA approved. We have Botox, Dysport, Xeomin, Latabo, Nuceiva, and Relfidus. So there's six TGA approved products in Australia. And, it is one of our most common treatments, isn't it?
It's by far the most common because anti-wrinkle injections are your gateway to everything else. Because if you're a little bit scared or if you're unsure of what you want to do, but you want a little refresh or you're not sure, how you're going to look and you still want to look like yourself and you don't want to have too much work done, I think that first step into having the anti-wrinkle really gives you an idea of just how fantastic cosmetic injectables can be. Because, you've got people that are used to looking at themselves looking quite dehydrated, looking
Mm.
tired, and just looking overall, I guess, your chronological age. So, once you sort of start using, I always say it's almost like an iron. So, like it's like an
Yeah,
iron on your face, it just smooths everything out. And it still does if it's placed correctly and the dosage is correct, which that's always going to be down to, your injector. But if you have all of those things on point, the results are fantastic.
yeah, they really do. Not only do they sort of iron out some of your wrinkles, but they do lift some areas like the eyes, they can lift, and also they can
Mm,
help sculpt jawlines and things like that. So they can actually
fabulous.
really refresh your face. And I actually think it's a
Yeah.
really natural looking treatment. Obviously, look, if there are some things that can happen, like you can get a bit of a brow drop, like your brow drops a little bit lower, or you can get some funny shapes in your eyebrows, but they're temporary. So,
Yeah.
but it is a really natural looking treatment, I think.
Yeah, and I mean, look, natural's always dependent on who you're talking to because,
Mm.
someone else has a version of what they think is natural, and that may not be what I think or what you
Yep,
think.
that's true.
So, I think natural's very dependent on the person. I've got clients that come in that say they want a natural look, but I'm like, sis, you're not getting a natural look. Like you've got nearly 80 units in your whole face. Like that ain't natural. So I think people need to be aware as well of the terminology because sometimes what you say, is not actually what is happening or what it is.
Yeah. And I think when people say natural look, they're actually saying, I really don't want people to notice. And people don't really notice.
Mm.
Not really,
Yeah.
you know, if you
Look,
can't
and
frown or,
and if they do, so what?
eh,
Like I've never been someone to really worry about it. Like at the moment, there's not
yeah,
a lot
you and
going on
I.
there, and
So
couldn't
those
be
watching us
happier.
on YouTube, we're both frowning
Yeah,
into the screen and you
we're
can't
both
see
really
me.
frowny.
But I can raise my
And I
brow. I
mean,
don't
I'm
do
all
my
for it.
forehead. Yeah, me too.
Don't you?
No,
You don't do
but
your forehead.
I don't treat my forehead because I get brow drop. It drops my brows and yeah, I've already got a 5 head, so it makes it even bigger. Yeah.
You could
So I don't do,
build a tent on mine. So,
look, let's measure. I think probably about the same.
jeez, it's all happening up there. But yeah, I definitely do it. I don't have to do it that often. And I think one of the great things about anti-wrinkle is and can be is if you do use it as a preventative medicine, earlier on in your life, or, I guess really whatever
Mm.
stage that you decide, it does actually help stop the formation of more wrinkles in certain areas and how deep that they are. So you really can sort of turn back the clock and stop the clock a little bit with it as well. So
Yeah.
I love anti-wrinkle. I think it's actually my favorite treatment. I think it's
I
fabulous.
agree. And that sort of segues into our next thing we want to talk about is why are so many people, why are they so popular? And that's one of the
Mm,
reasons is it is preventative.
yeah. I mean, I think I was 26 when I first started getting it done, which was a long time ago now.
Well,
But
I was 39. I was a little bit older than you. I was 39.
yeah, I always think that that's really interesting that you waited so long. Yeah.
I actually get quite a few clients that start later. And
Mm,
I think I started noticing aging then. I've always looked pretty young for my
wow.
age. Yeah. And I've always looked after my skin. So I didn't really notice fine lines and wrinkles until I probably got to my late 30s. And I thought, no, I need to get this done. And
Wow. Yeah, well, I was
I
on
love
top
it.
of that at 26.
Yeah. And I do see some young people because they're starting to get some of those deep lines. And lines aren't really aging, but when you're young and you're starting to
Yeah.
get wrinkles, I see a lot of young girls that say, look, my dad has these deep lines or my mum has these deep lines. And I'm starting to notice them on myself. So they want to
Mm.
prevent that. And that's why people are getting it as a preventative.
Look, I do have younger girls that do want to come in and get the anti-wrinkle, and I'm not one of those people that is pushing it on the younger girls. I definitely say, obviously in the consultation, what are your goals about it? Because I think some younger girls do it because they think that they should or that everyone else is doing it. So I think that that's a really good point, that just because, girls that you're, working with or girls in your age group are doing it, it doesn't necessarily mean that you need to. However, the feedback from the younger sort of girls is more that they're not enjoying when they're putting on all their makeup, the lines with the makeup, and
Yeah.
that's actually a catalyst into them wanting to have the anti-wrinkle, because when they're putting their makeup on, they're finding that there's a lot of lines and the makeup isn't sitting properly, which I find
Yes.
incredibly interesting, because when I was, 20, I didn't even think we wore that much makeup back then. Like, it's not like it was a million years ago, but I really feel like it's really changed in how people are perceived now in their age groups. So, when I was
Mm.
20, I think we just did a little bit of lip gloss and blush. So it really didn't matter if you had the anti-wrinkle or not. Do you know what I mean? Because we weren't wearing all the foundations and things like that.
Yeah. I also think the selfie revelation has
Phenomenon.
phenomenon.
Yeah,
Yeah.
yeah,
So
yeah.
because we never used to take so many photos of ourselves. We never used to look at ourselves that much. You did your makeup in the mirror and you went out. And the only other time you
Yeah.
looked at yourself was when you went to the bathroom in the wherever you were to touch
And we're
up, but you
horrified.
didn't. Yeah, and you didn't look at. Yeah, it's true. And makeup's running, and anyway.
Yeah, well, I
But
mean,
yeah, I
we didn't have phones then. So,
no.
it was
So
a very different era.
we're looking at
Yeah.
ourselves a lot more.
Horrific.
Yeah. So basically, how anti-wrinkle injections work, I do get some patients who confuse Botox or anti-wrinkle injections with dermal filler. Now, they are
Mm.
completely two different treatment. So
I know.
anti-wrinkle, I
You
know,
get people, whenever people want to give you a bit of a hard time, they're like, stop putting filler in your forehead, stop putting Botox in your lips. And you're like, you can't, what are you talking about? Like, it's the complete opposite of what you're saying.
yes,
I've actually had people say that to me, like, stop putting
yeah, me
Botox
too.
in your lips. And I'm like, that's not Botox, hun. That's
Yes,
actually filler. Like,
yeah.
if you're going to have a crack at me, make sure you know what you're having a crack about, you know?
So with anti-wrinkle injections, just very basically, we inject it into a muscle to prevent that muscle from moving. And it takes about 3 days to see it start kicking in, and it peaks at 2 weeks, and then it gradually wears off. So the idea is that we inject it into a muscle, stops that movement, which is stopping the creation of lines and wrinkles. That's what we're doing. And
Mm-hmm.
and it's a temporary treatment. It's not permanent, it's temporary. So that's a basic idea of anti-wrinkle injection, is that we're
Yeah.
injecting
And I
into a
think
muscle.
that that's a good point to make for people as well when they are trying it for maybe the first time. It's not going to be permanent. So even if you feel that maybe your dosage was a little bit too much than what you had hoped the outcome would be, or if it wasn't enough, obviously you can always add more. But I think it's a good point for people to understand that it's not permanent. So it will over time wear off. And whether that's good or bad, it will wear off.
Yeah. The great thing about this treatment as well is that there's very minimal downtime and very minimal risks. And
Yeah. You know, you can go in and get your Botox done. I mean, if you have a consult and you're across it and everything's good, and you speak to the doctor and everything's okay to go, I mean, you can really do it in really minimal time.
mm,
So it's
mm,
not one of those treatments that you've got to block out, 1 to 1.5 hours for.
yeah. And if you've got to have a complication, generally it's something like a brow drop or a
Mm.
bruise, and that's very minimal. Bruises
Yeah.
heal. Your brow drop, which I've had multiple times, it wears off within weeks. And people don't really notice it. When you've had it done, I noticed it on
Mm.
myself, but no one really noticed it that it happened to me, but I could feel the heaviness, so
I
they're,
think you
they're
feel
really,
the heaviness, but I don't necessarily think that that goes hand in hand with a brow drop. I think they're two very separate things because I know that when you're injecting in the forehead area, and I'm pointing to my forehead, it can feel heavy, and of course it does because you've got anti-wrinkle in there. But I don't think that necessarily goes hand in hand with a brow drop, or to expect a brow drop
if you
because
feel
your
heavy.
forehead is feeling heavy. I
Yeah.
just think that that's part of the process, and that's it sort of starting to work. And as I think I've spoken to you before, Janine, like with one of the products that I use, we have a really, really, really quick turnaround with how quickly the toxin starts to work. So, you
Yeah.
have clients that are walking out feeling heavy in the forehead straight away. And
Mm.
that doesn't mean that you're going to have a brow drop.
Yeah, and that's why we take before and after photos, and I assess them. There have been a couple of my
Mm.
clients where they have had a brow drop and it was only picked up in their photos, and it's only a few
Wow.
millimeters. And they've said, "Oh, I didn't really notice it, Janine, but I've noticed. Okay, you did have a bit of a brow drop. Maybe we need to look at. Do you still want to get this treatment moving forward if it's going to do that?"
Yeah.
But yeah,
I
that's
mean,
why.
you've got to be happy.
Absolutely. So let's debunk some of these things about these injections. So, I mean, obviously, we talked about it is different from general filler, and we'll talk about that in a future episode, but it is an intramuscular injection. So we've debunked that. Now, another one is, does your face sag if you stop injections? Do you want to answer that one?
Well, no, it doesn't. The aging process is always working in the background.
Mm,
When we do use anti-wrinkle, obviously when you're looking at someone's face, you don't see the aging as much because, as we had mentioned before, we're sort of ironing out those areas, but the aging process is still happening.
yes.
So when you stop doing the anti-wrinkle, and who knows why you would stop? I mean, why would you do that? Like, especially once you've started it, I don't know why. But if you've decided to stop for some reason or due to a health concern or whatever that may be, um, it's not that you're going to be saggy, it's just you're going to go back to the way that you were looking or were meant to look prior to those injections. So it's not from the tox that is making you get a sag. It is
No.
your actual natural face. That's how your
Yes.
face is supposed to be. So, yeah, I mean, I think that that's important to note as well because people always want to blame someone for something, don't they?
Yeah.
But it's actually just your face and it's the aging process. And,
Aging
you
process.
know,
And you
that's
have to
it.
also consider how old are you. So if you're hitting
Mm.
around 40, you're going to really start to notice some aging, and sometimes it it sort of hits you overnight. And they did do
Mm.
they did do some research on this, and they found that the two ages that people notice that they've started to age is 44 and 60. And I would
Yeah.
agree with that. I see people coming to me in their late 30s, early 50s saying, Janine, I feel like I've aged overnight. And that is a true phenomenon, especially for women who have to go through menopause. We do
Yeah.
age differently to men. And so we notice this change in our anatomy, in where our cheeks used to be high and lifted, now they're beginning to sag. So those things are happening as well. So you have to consider those things
Mm.
when
I mean, the
you're
hits
when
just
we
keep coming for us, don't they?
they do. So yeah, you've got to consider the aging process as well. You're not going to stay liquid
Mm.
foods forever, which would be ideal, but it just doesn't.
I think it's better that you look good for your age than you look
Absolutely.
good looking 20, you know? Like, I
Yes.
mean, at my age, which we won't go into, but I want to look good for I want to look good for me. I want to look good for
Yes.
how I'm supposed to look at this stage of my life. I don't want to look 20. I wouldn't be 20 for
No.
quids, but you know what I mean? I want to look as good as I can. So I think
Mm.
anti-wrinkle and the cosmetic injectables that we can do as registered nurses are fabulous for those types of things.
Absolutely, I agree. And I want to look, once again, I don't want to look 20. I find that as you get older, your face does become more defined. You get more sculpting in your face. And I quite like that. I had quite a chubby, full face when I was younger, which I did not like.
Yeah,
And I see a lot of young girls that hate that as well. But those beautiful,
hang on to
you
it, girls,
know,
because once
I
it's gone, it's
know
gone. Yeah.
those
Yeah.
beautiful fat pads are awesome. And I'm very
Mm.
grateful for it now because I do still have fullness in my face and I've got
Yeah.
nice full cheeks. I have no idea where I lost my train of thought there, Christy.
That's okay. We can just skip on back to the anti-wrinkle because there's always something to say about it.
Yes. All right. Let's go to the next one. There is this misconception that the anti-wrinkle injections stop working after having them for 10 years. True or
I don't know
false?
who came up with that.
I
Like, I
know.
mean, where did that even come from? 10
Don't
years?
know.
Why 10? I don't know. I've never heard of it. I've been doing anti-wrinkle. I've been doing anti-wrinkle for longer than 10 years. Sorry, I'm like, been doing it for longer than 10 years. And I can
Me too.
guarantee if you're watching this, you can see me. I'm really, really
Mm.
frowning. I'm smiling. There's no movement there. So that's a complete myth.
Yeah,
Complete myth.
I had a patient come in one day and she had heard this and saw it on social media and a few people have mentioned it to her. So I'd never heard of it before either. And so I
Mm.
thought, well, let's debunk this. But what does
Yeah.
happen over time is sometimes our dosage needs to change. And that's due to our own biology and whether we
Hmm.
need to increase the dose or whether we need to change a product because you've built resistance. Those things do happen. And obviously everyone is different. So we assess people individually. So I don't know whether
Yeah.
there's been people that have had it not working so well. Can I be honest? I have had that myself and I've changed product and it works magnificent.
Well, I think it's important to note that also some people want to spend $200 on getting their full face done. And I mean, that's something that really needs to be debunked because especially once you're in your 30, mid 30s to your 60s even, you're not going to get that. I mean, I don't even know what area I would choose if someone said to me, I've only got 200 to spend. Like, you can't spend that and get a good result. So sometimes back in the day, the prices might have been a little bit different. You may have needed a lot less. So you were sort of getting it done for, your 400s or something like that. I would really, 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 it's very, very difficult. I don't know if the words challenge someone to have it for that much, or I don't know, but I can tell you right now, if you're spending that much money and you're in your 40s, your dosage is incorrect. Because it's absolutely impossible to do a full face or 3 areas on a woman in her 40s and give her a good look and make that last the time that we would expect it to, which could be, the 3 to 4 months. Sometimes it's less. But if you're spending that minimal amount, yeah, I'm really dubious about how that's happening because I don't know what you're using.
Before the TGA came in with these new regulations for aesthetic and cosmetic nurses and doctors, you're not allowed to advertise Schedule 4 medications. And this
Mm.
injection is a Schedule 4 medication and it requires prescription.
Yep.
So before that came into play, people were doing Groupon deals. People were advertising these really cheap deals for the anti-wrinkle injections. I want to segue into, there was an article in the paper earlier this year that talked about someone had imported Botox into Australia and injected their friends. Now, those people ended up in ICU. Now, this person wasn't a medical practitioner. It wasn't an existing nurse or doctor in the industry injecting. It was somebody else that had imported this from somewhere and injected their friends, and they got very, very, very sick. Now, this is, I think, there were people back in the day that were buying inferior products. There are inferior
Wow.
products around. I don't know how they get into Australia, but let me say this. TGA are very strict about what gets released in our country, and we've got 6 neurotoxins at the moment, and they've all been through that TGA process. So make sure, I think you know what product is being injected into your face, and even know the dose. I had a client the other day, and it was great. They're a brand new client. They'd been going to Melbourne, weren't traveling there anymore, came to see me, and their aesthetic practitioner had given them their notes. And so I could see them, I could see the dose, the drug. So they were well informed about what they had. And we are required to do that as well. But I know there's some practitioners out there not telling their clients what drug it is and what dose. And I think we need to make sure that people are fully informed about what they're having injected into them.
And I mean, as part of the part of the consultation process, I'm always letting my clients know what we're going to be using, what we're going to be expecting it to look like, how long we're expecting it to last for. This is the approximate price, and then you move forward organically in how you want to go with that consult. So I think those things are really important to discuss. And I think, when someone also on the flip side of that, you can also have patients that come in that say, I get, 5 units here and I get 2 units here and that's what I get and that works and blah, blah, blah. I think that's fine that you may have had that previously, or that may be fine that that's worked someplace else. But I think when you're going in to have a consultation, especially as a newbie with a new nurse, it's a really good idea to let them consult you and assess your face and tell you what they think that you need. You can always come to some sort of conclusion together on how you want to move forward. But I think when you're going into someone, it's good to get their opinion and let them actually assess you, not sort of tell people what you need to have done. Because, we spend a lot of time, studying and doing extra training courses, and it's a constant journey of learning and adding to our skill base. So I think it's really important to allow us to make an assessment, and then you can move on from there, not sort of just tell people what you need as well.
With every medication, there is a dose. So if you're taking, let's just say paracetamol, it's recommended you take 1,000 milligrams. That's 500 milligram tablets. Just say you had a headache. It's the same here. There is a therapeutic dose for the different muscle groups. So if we were treating a frown, there's a different dosage for that than your crow's feet or your forehead. So they all have a set therapeutic dose. And it's important to know that it's not just sprinkling a few units here and there, that we need to consider the therapeutic dose to get the maximum result and the best outcomes for you. And that's what we talk about in our consultation.
Yeah. And I mean, the phenomenon of baby Botox, like what?
That's interesting.
How can a full-grown woman in her 40s have baby Botox? Like,
so do you want to debunk that for us? What is baby Botox?
Well, I mean, look, I haven't really launched too much into it because I just don't understand how it can even be a thing. Because I have had clients sort of say to me, "Oh, what's this baby Botox? Just a sprinkle of tox." Like, you can't just sprinkle tox. You're either doing it or you're not. Because the reality is it's either going to work well and you're going to get a great result, which then reinforces you to want to continue having that treatment, or it's not. Now, if you're sprinkling tox on a 45-year-old woman, how is that even a thing? I mean, sprinkling tox in your forehead, sprinkling tox across, your frown. I mean, is that even going to work? Like, I mean, I don't know what people would consider a sprinkle to be, but if we're saying for argument's sake, we're doing 20 across the frown, and I'm using the word so that everyone understands, not the medical terms. If you're using 20 units across there, just say for argument's sake, and without getting too into it, that's probably a Botox or a Xeomin sort of dosage, yeah? And you're using that for a regular client that comes in, regularly. A sprinkle, what's that going to be, like 10 units across the whole area. I mean, I don't even know if that's going to work. So for me, the phenomenon of the baby Botox for a grown adult, look, maybe for a younger lady that's, 19 or 20 that's just starting the journey with anti-wrinkle, that could be a thing. But I think for someone that's, you've been doing this for a while, even if you haven't, a baby sprinkle of Botox is really not going to cut the mustard for you. It's really not.
And that's the thing. So this baby Botox phenomenon must have taken off from social media. And unfortunately, a lot of these social media trends come from international areas, so America or the UK, and they're interesting. And don't believe everything you see on social media. Don't believe everything that you read and see. Always talk to a professional. In Australia about it, we are very highly regulated, and here in this country, very regulated. And some of these things you just think, what is that? What is this little fine sprinkling? It's just like, okay, let's use the paracetamol for the headache, and your doctor saying to you, oh, just go and have a sprinkle of Panadol and you'll be fine. It just doesn't work, right?
No, you can't have a sprinkle of Panadol and you can't have a sprinkle of Tox.
No. So, I think we're almost that time up. Yeah, so almost that time out here. So I think we've sort of debunked the main things that we get in our clinics. But if you've got anything you want us to debunk or discuss further, please email us at beyondthebabblepodcast@gmail.com, and we would love to answer any of your questions. Please send us kind emails as well, but please email us.
There's nothing too crazy, but yeah, we would love to answer your questions. And if we haven't covered anything in any of the episodes when we go through it, send us through the email and we'll be more than happy to have a chat about it.
Great. Well, have a good day.
All right. Nice chatting. Have a good day, everyone. Thanks for listening. Bye.